Welcome back to Hometown Healthcare, where we are interested in perspectives and innovations in community healthcare. I'm Charlie Barnes IV, owner of Barnes Healthcare Services, also known as Barnes Drugstore in my hometown, Valdosta, Georgia. We have been in operations for over 110 years, so I'm excited to join you today to talk about what we like to talk about in this series, which is the future of healthcare and how things are transforming. So I think lifestyles is what we have been talking about and we'll probably continue to do because I think that's where it's at. And there's something interesting that I've looked at for a few years and I really would like to see it take off more. And it may be across the country, but I thought I'd share that with you today. It's something called FVRX. What that stands for is fruit and vegetables prescriptions. So instead of your physician, or instead, maybe not instead of, but it could be instead of your physician prescribing a medication, maybe you start off with meal planning, fruit and vegetables. Maybe you add that to the mix and also have a fruit and vegetable prescription that are paid for by the health plan or paid for by another means, a community resource or something along those lines. So pretty interesting concept. It first crossed my radar in about 2015. It was something that I was aligned with. Actually, the Georgia College of Medicine did a little pilot. They were using their students and their medical students, and they would identify a population of individuals that may benefit from FVRX or fruit and vegetable prescriptions. And so they had their students monitoring patients that were identified every single week that they were given these fruit and vegetable prescriptions. Now, in this case, there was community resources built around providing it. They basically got tokens that they could use at the farmer's market, and they got fruit and vegetables. They also had some educational resources around how to prepare meals, and they had some transportation resources to make sure they could get to the farmer's market or get to being able to get these healthy vegetables, because a lot of people live in food deserts, as we've probably all heard about, and they just don't have easy access to it. They don't have transportation, whatever it may be. So this program, it had some pretty good results. It was a very small sample size. I'm hoping it's still going on. I need to check, but yeah, the results, they had their blood pressures went down significantly, everyone that completed the course, and their mental health improved. Just overall, just quality of life and satisfaction improved just across almost every bar. I think the most measurable clinical was around their blood pressure, which can lead to all kinds of heart problems as well as other problems. So I think it clearly showed it was a very, very small study. But then I saw another one here recently coming out of California, where the physicians were prescribing FVRX, food and vegetable prescriptions, to a population of patients. Now, this population, what it looks like, is much bigger. It was funded a lot differently, and they were doing tailored meal planning for all the participants that went through this program. And they had some great results from this. They were showing by having this intervention in this population, you're looking at low income usually because they don't have the funds to be able to produce, to get healthy food, or maybe not the means, maybe not the education, whatever it may be. So these tend to be focused on the low income. But anyway, in that population, they found that there was a 37, no, take that back. There was a 50% reduction in hospital admissions tied to these patients. They were primarily chronic heart failure patients in one study. And they saw a 50% decline in hospital admissions. And when they went to the doctor or went to the hospital, there was a 37% decrease in the time that they spent there. So they were there a shorter amount of time, a lot less there, and they were there for a shorter amount of time. And this is the one difference that was going on with this population versus other populations, that they were doing this tailored meal planning for them, and they were covering the cost was being covered through this. They also, there was another study that found similar results. It focused on diabetes and HIV patients. They found that, again, that improved all comorbidities that may be affected with them, had statistical clinical improvements there, overall mental well-being also improved, and also risky behaviors, right? If you're impoverished, then a lot of times you take on risky behaviors to be able to provide for your family. It's just a fact of life. And so they saw that decreasing as well. Now you can equate this. We could provide the meals, healthy meals, to somebody for 6 months, right? Say the sick patients that need, if we do this, we're going to see these results. We already got a result here from this study, 50% reduced readmissions. If we provide 6 months worth of food, healthy foods, meal planning, so that's some coaching and counseling, probably meal preparation. There's probably a lot that goes into that. For 6 months, that's equal to half the cost of one hospital admission. So think about it. Think about what that could mean if they're not going back to the hospital. I mean, you're getting an enormous amount of savings. And already we know that there's tens of billions. I mean, this study actually said $24 billion in preventable hospital readmissions that are happening across the country. And I know that number is a lot higher than that, knowing that we're up to $4.2 trillion. I think it's the latest number on healthcare spend in this country. So I think this is a big step forward. This study, they don't know if their California Medicaid is going to take it on and actually start covering it. But I think it's something you're going to see happen. I think the financials are there. The return is there. There's going to be some things of how to make it work, but the community is going to support it. Employers are someone's going to support this because it financially makes sense. And I think it's great. I think it's great in the sense that changing the behaviors, changing your lifestyle, what you eat and diet, it looks to me to be the number one thing you can do to change your health. There's a lot of other things that go with it, but when you look at across the board, everything and the impact it has, diet looks like it's the number one thing. And that's a phenomenal thing that we can help support and provide education around as a society and provide the right care for it. So with that, I hope you found that interesting, and we will talk again next time on the Hometown Healthcare Series. Take care and all the best.